I just want to explain something that kind of frustrated me that's been happening with this pregnancy. But my daughter's playing with a styrofoam cup and like a straw, so if you hear noise, that's what that is. So on October 16th, I had a growth ultrasound for the twins, and they noticed that baby A, which is my girl, she is a lot smaller than he is, and her stomach circumference, her abdominal circumference is in the 10th percent, which is very low, and his is in like the 93rd percentile, so like he's chunky. So they mentioned that there could be an umbilical cord issue with my daughter, but we don't know for sure yet. They wanted to wait 3 weeks to see if, that 3 weeks would give her time to grow, and maybe her scan would come back different. So since that scan, it started like shortly after, I started noticing decreased movement with her. I can tell exactly where they are, like at all times. So I know it was her, and I just wasn't feeling her as much. So I mentioned on the 29th of October that I was not feeling her as much, that there was decreased movement, and all that stuff. And my doctor was like, okay, if you're still having that issue, or it gets worse or whatever, go to labor and delivery, let them know that, get checked out. So the 31st, Halloween, I was at work, and I'm a receptionist, so I sit down all the time. Like, I would be able to feel her. I hadn't felt her all day, so I was kind of getting worried, and I was like, it's one thing to have decreased movement, and then it's one thing to have no movement. So I was like definitely freaking out. So I started drinking soda and like pressing on her and like trying to make her mad, trying to get her attention, all this stuff. And I was only getting kicks from him. And I eventually got like 1 or 2 from her, but they were very like small movements. Like it was not like a kick. It was just kind of like a little tap, So I went to labor and delivery, and I told them everything. I said I'm having decreased movement in baby A. They think there's an umbilical cord issue. I would like to get checked out, all this stuff. So they checked me in. They got me into triage. They hooked me up to a non-stress test, an NST, to check heartbeats, check movement, all that good stuff. Sorry, I'm having a contraction right now. And I would just like to say that as of Halloween, I'm 29 weeks, so yeah, and I'm having di twins, so everything's separate. They're in their own sac, own placenta, everything like that. So they had me hooked up for an hour, and they said both heartbeats look good, you're good to go. And I was like, that's all you're gonna do? Okay. So they said, call your doctor tomorrow, let them know everything that happened. They may want to do a BPP, which basically checks like fluid, umbilical cord, like everything like that, movement, heartbeats, all that stuff. So I messaged my doctor as soon as I got out of the hospital, like immediately, so that I wouldn't forget, and so that they could get back to me as soon as they opened. Told them everything, and I got a message from my doctor, or the nurse, saying that my doctor was out of the office that day, and another doctor would be in touch. Sadly, no one was in touch with me that day, which was a Friday, so they closed early anyway. And I told my husband, I said, I have felt her a little bit today, but it's still very decreased, and I feel like I got kind of blown off at labor and delivery. And I'm in some multiple groups and like mom groups, so I kind of posted about what was going on and like explained everything, the backstory, what happened to labor and delivery, and everybody was like saying you need to go back and have them do an ultrasound because my friend lost her twins that way, I lost my twins that way, like all this stuff that was scaring me. So Saturday rolls around, and I had called my nurse triage Friday night to ask, like, should I go in and demand an ultrasound? And they said, yes, you need to go in and ask for an ultrasound because I don't know why they let you leave without one. They should have done it. And so I went back and said, like, my nurse triage said I need to get an ultrasound, not leaving without one, basically. So they got me all checked in and got me hooked up to the non-stress test, all that stuff. The nurses were like, okay, we're going to have a midwife come in and talk to you. And I was like, okay, whatever. It's just a random hospital midwife. Don't know who she is, but she was going to come in and talk to me. And she did. So she comes in and talks to me. And basically what she does the entire time is says, well, my die-die pregnancy didn't go like that. My twin pregnancy didn't go like that. I had die-die twins too, and they didn't do that. Or I didn't have that issue, so that's probably not happening with yours. My doctors treated me this way when I had my twins. Well, they should have sent you to a high-risk doctor already, because that's what they did when I was pregnant with twins. Like, everything was about her and her pregnancy with twins and not about what I was specifically going through. So it was getting very frustrating, and my husband was getting very snappy, which in that situation he needed to, because he knows that I'm gonna clam up because I don't want to be a burden to people. So I already told him I felt bad about going into labor and delivery anyway, because I feel like they were gonna think I was crying wolf, but I'm glad I went in now. So basically she was getting tired of us getting snappy and saying that we're demanding an ultrasound, we're not leaving without one. So she said, well, thankfully your doctor's on call, your OB, so I'm gonna go give her a call and see what she wants to do. So it was like 15 minutes later, my doctor, my OB that I see regularly, she walks in with an ultrasound machine. Praise the Lord. So she's like, we're gonna do an ultrasound and we're gonna check and see what's going on, because I know you mentioned to me that you're having decreased movement, and with everything else that's going on, with her measuring small, with this and that, I want to make sure she's okay. And that's all I want to hear is like, hey, I know your case. I know what's been going on. I know what you've been saying to me. I know what's in your chart. So I'm going to listen to you, not just, well, I don't know, you look fine, because heartbeats don't mean that, like, we're good, you know? So they do an ultrasound and they're like, okay, your baby B, he's doing amazing. He's got so much amniotic fluid, like not a concerning too much, because that's a whole nother problem. He's got a good amount and he's big, like he's doing good. So let's move on to baby A. Baby A, and she's like, let me see if I can find some amniotic fluid, make sure that we have a big enough pocket that we're not going to be worried. And basically she's looking for a long time. It takes her a long time to find even a 2-centimeter pocket of amniotic fluid. And she's like, yeah, she doesn't have a lot of amniotic fluid. That's why she's not moving. Like, her heartbeat's fine. She's okay for right now. But, like, have you been leaking fluid? You know, all this stuff. So I was, like, answering the questions and everything like that. And basically she's got low. So then they were also monitoring my contractions, and I've been having pretty consistent contractions, but I told them I thought it was just Braxton Hicks. But they said since my contractions were so consistent, they wanted to check me. And they said that I was 1/2 to 1 centimeter dilated, but that my cervix was still, like, long. So I wasn't in active labor or anything. I just needed to go home and rest. And that they would see me Monday or Tuesday for a BPP in office. So I'm just so thankful that my doctor saw me, because I wouldn't know that I was leaking amniotic fluid and that she didn't have a lot. So now it's like really alerting them that, like, something's going on with baby A. So, like, we need to keep a really close eye on her, because she's very small and she's leaking fluid. So just want to say I love my OB. So I'm so thankful for her, and that she put my fears at ease, that she is okay, but there is something we just need to keep an eye on, in the, you know, moving forward, because I could have to deliver them a lot sooner than January. So we'll see.